Hi, I'm Molly Sullivan with Golfers MD, your source for all your golf health, fitness, and injury information. Many golfers are prone to tennis elbow because of the repeated use of those muscles, leading to small tears of the tendons. The pain and injury can often cause golfers limited mobility and misplay. Today we visit Dr. Rhonda Bosheron, sports medicine orthopedic surgeon and athletic trainer, to tell us more about tennis elbow injuries.
Tennis elbow is an injury to the outside of the elbow, which is in contrast to golfer's elbow, which is at the inside of the elbow. It usually involves the extensor muscle group, which is the muscle group that allows extension of the fingers and the wrist. Usually you can get this injury after extensive load to this muscle group and that there is a traumatic tear or microtrauma that occurs with chronic use or poor biomechanics of motions used to extend the wrist or the fingers. The symptoms usually are pain right at the outside of the elbow that can move below or above the elbow. It is usually quite severe and the pain can radiate down into the hand. The treatment usually involves correcting the biomechanical issues that predispose the athlete to the injury, addressing overuse type of activities that might also put the athlete at risk, utilizing anti-inflammatory medications and modalities, as well as physical therapies to help the symptoms as well as to rehab the injured area. Athletes can usually play with the tennis elbow if they're in a running sport or a sport that does not require extensive extension of their fingers or loading of the wrist in an extended format. However, those athletes that play racket sports or have sports that require a lot of extensive loading of the forearm or the hand may require a short stint of rest if their symptoms are quite severe.
I had the good fortune of working with Roddick for 8 years. When I first started treating him, he had tennis elbow. He was playing his first ATP Tour win he won with a tennis elbow. Now, they treated it in the training room with ultrasound, some massage, some stretching, some anti-inflammatory type modalities such as iontophoresis, phonophoresis, which is just using some anti-inflammatory creams. And he was able to finish and win. However, the question I asked him after the game was, how long have you had shoulder pain? And he looked at me like I was crazy, and he said, well, I have elbow pain, Bob. I said, well, how long have you had shoulder pain? He's had shoulder pain 1.5 years. So, as my good friend Jeff Cooper, who was the head trainer for the Phillies for a long time, said, when you have elbow pain, you missed it 6 months ago. So an overhead throwing athlete with elbow pain, you need to look at the shoulder. Very important to get the muscles strong and good flexibility around the shoulder.
Be sure to keep these tips in mind when you prepare for sports and want to stay strong and healthy. I'm Molly Sullivan with GolfersMD.com. Remember, at GolfersMD, health equals performance.